Hi, and welcome back to the WHY-O-MYO podcast. This is Janine Steen, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy.
Disclaimer. All content, details, as well as education shared on this podcast are the opinions of the speaker and are for informational purposes only. Please consult with a certified medical professional regarding any questions or concerns, as this podcast should not serve as a diagnosis or replace the information received from a healthcare provider.
Hi, and welcome back to the WHY-O-MYO podcast. I wanted to take today's episode to talk a little bit about some of the sleep disordered breathing that's seems to be monopolizing the questions and answers lately on the news channels and the doctor shows and articles. And everyone's talking not just so much about sleep apnea and the importance of identifying it, but also why it is so important to have a good night's sleep and why sleep apnea is such a detriment. I know personally, as a speech language pathologist, I cannot diagnose sleep apnea. I can't tell if a patient has it. I am, depending on the patient's age, I'm trying to determine, am I seeing enough characteristics? Am I not seeing enough characteristics? Should I refer just to be on the safe side? Or I don't want to refer because I don't want the doctor to think I don't know what I'm looking at. So it's literally like these internal struggles in my brain trying to figure out which mode or which way I'm going to go. And, but yet the more I speak to other professionals, especially those that have anything to do with sleep issues, I definitely find that they have the same questions. I also, not until very recently, maybe for me in the last 4 years, but it's been definitely longer than that, where I've started to see just a huge focus of dentists becoming more involved when it comes to sleep disordered breathing and identifying sleep apnea and identifying some of the causes. And some of the practices even have at-home sleep study kits that you can get from them. And what would happen is they would see the dentist would put them through this sleep study, so to speak. It's definitely formal, but it's more informal than what you would get in a sleep clinic. But the benefit of it is that after you complete it, you will get the results, and the results are the results. If anything, especially with kids, although I feel like adults too, that when you're going for a sleep study in a sleep center or in a hospital, it is not a very natural environment. You're hooked up to tons of wires and machines, and you're supposed to almost like on demand be like, okay, ready, set, sleep. And now you want someone to look and see what you do when you're sleeping. And they're also diagnosing if you are able to get into a REM sleep pattern, a really deep sleep. And what's confusing to me is that even in those situations, are you really ever going to get into a deep sleep, especially in that type of environment? And are we getting a ton of false positives? Or is it the other way where I'm identifying some of the issues or a dentist is identifying some of the issues and refers them to an ENT, and the ENT will then make the determination if a sleep study is necessary. They won't 100% of the time just take our advice or our concerns as a reason to go forward. It's hard enough for us with some professionals when we refer, especially to ENTs, is to make sure that they're scoping them. It's not uncommon for a patient to come back and say the ENT didn't think I needed to be scoped, or the ENT really doesn't agree that there could be a sign of, or these are signs of sleep apnea, or even I didn't go to the ENT because the pediatrician said that they weren't concerned. But then, we're looking at this patient, and especially as a speech pathologist and myofunctional therapist, we're looking at this patient thinking, okay, you have all of these signs and symptoms, yet we can only base that on what we're being told and what we're observing as a speech therapist. And the best we can do is refer them to an ENT and report our thoughts and hope that they go the extra mile, or do, this is literally just a very new option, and which I think is awesome, is do we refer them to a dentist's office that is able to provide sleep study or sleep kits. And I know in particular, Dr. Edelberg's office, Edelberg and Montauban, here in New York, they have a few locations around Long Island, but they offer that, which I think is tremendous, especially one, if you're not exactly certain as an SLP if what you're seeing is truly a sleep apnea or what is being reported. Two, for information, you can make your appointment, go through the dentist, get that sleep kit, get the results, but do all of that in the interim while you're waiting for your appointment with the ENT. And then at least you can bring the findings and say, look, this is showing me that I have sleep apnea. Can we do, an inpatient sleep study? Or it's not showing that. Should we do one anyway? Or it's not showing anything, but I still have all of these symptoms. And maybe it points them in a different direction. I definitely think it could be a benefit all around. And again, also just from the perspective of, as speech pathologists, we're looking at the patient and asking certain questions. We're looking to see, do they have dark circles under their eyes? Do they snore? As adults, are they overweight? Do they breathe heavy? Do they toss and turn? Are they light sleepers? And then from the pediatric side, we're asking first if they snore, but we're not even as concerned about that. Now we really want to know, are they restless? Do they kick their covers off? Do they wind up sideways or upside down on their bed? Does it take them a while to fall asleep? Or do they have difficulty waking up? Are they hyperactive or inattentive? Are they diagnosed with ADHD, attention deficit hyperactivity disorder? Are they just, are they having issues with processing? So all of this information is even down to, are they still wetting the bed? Or do they have a diagnosis of a learning disability or struggle in school? Because for pediatrics, those are all symptoms. And I don't think we know that. I don't think every speech pathologist knows that. I don't think I don't even know who wouldn't know, but I can guarantee the majority don't know. And I think especially parents, they don't know that either. I think we're just so conditioned to think snoring, sleep apnea, that if there's all these other things, not realizing that could be pointing in that direction. And the other piece too is, if they have a misdiagnosis, it's important to have that knowledge so you can rule that out, especially when ruling out or ruling in a learning disability or an attention deficit disorder, or even wetting the bed, where people will start going to urologists and their pediatrician and having all these invasive tests done. And a lot of times it's sleep apnea. And when it comes to sleep apnea, it also affects the certain matter in the brain, and it says it affects its overall development. And there's even some studies that say it can result in a deterioration of, or a lack of development of, this matter in the brain, so that it has a long-term negative effect. So, from a pediatric standpoint, I think it would be significantly important if as part of your physical each year, that the pediatrician ask certain questions that perhaps could give some insight, or proactively look at the tonsils, look if there's, and ask questions about, are there signs of sleep apnea? Are they able to breathe through their nose? Are they a mouth breather? I just think some common characteristics and questions that would not be something you would do as part of your physical evaluation, and not something you would do during a sick visit, but more as part of your physical. And I just think, we always push for early intervention. That should be the most important with sleep apnea, especially in kids. If it's, putting kids on medication or watching them struggle for no reason, and I'm not saying no reason, but more to say that it's something underlying that a parent wouldn't know to ask for, and a doctor wouldn't necessarily be looking for. I think it needs to be a proactive approach. I also feel on the elder side, or the adult population, I think for different reasons, but I think that should be part of our regular physical. I think a sleep study should be part of your testing, just like they say you should have your first breast exam at 40, you should have your first colonoscopy at 40 or 45. You should start having whatever, your prostate checked if you're a man. I think it should be that you have your sleep patterns tested. And maybe, I know that would inundate clinics, but maybe we would use just the screener, or if we found true success with a screener, like the one the dentist does, but we notice a pattern, it's always off by the same amount on every one, maybe you can make an adjustment or make a guesstimate and intervene early. Sleep apnea in adults can affect aging, it can affect your skin tonicity, it can affect how well you sleep at night, your overall mood. Are you grumpy? Are you able to fall asleep on a dime? Are you never really in REM sleep? Are you a snorer? Now, for a wife, a snorer is a huge one. So I do think it should be in both areas. And I will say that there's a few themes I continue to hear discussed. One being, have a routine, go to bed around the same time every night. Make sure that the room temperature is anywhere from, they say, 60 to 67 degrees. I keep my house really cold. I'd rather be in my feety pajamas and under my down comforter than sweating with the fan on and the AC barely cool, and wearing, shorts and a t-shirt or a tank top. So that is not a big deal for me. However, the next thing is, don't keep the light on, don't watch television, to do away with screen time altogether. Then I think that's my most difficult part, is I like to fall asleep with the TV on. So I definitely, and I don't sleep well. And some of it is my own fault, just from, hearing over and over again. There are things that I could do. I'm sure there are things that many people could do that would make it better. But, like anything else, we choose not to. So again, no screen time, no going to bed around the same time, not drinking caffeine or even alcohol too close to bedtime. They say it stimulates you, or even eating too close to to bedtime, because you're digesting and you may have to get up to go to the bathroom, and you're drinking and then you're going to get up to the bathroom again. So creating this environment is important, and making sure you do certain things so that it's the optimal place for you to sleep, and that you have every opportunity to sleep well. But regardless of those things, or regardless of those people like myself who have definitely can make some modifications of those 5 important things, but yet still struggle sleeping. And then, there are adults that snore and have symptoms of sleep apnea, but they're not nothing is being recommended as a form of treatment. So whether it's mild or not, they're not suggesting anything. When we're talking from a pediatric standpoint, when a child is diagnosed with sleep apnea, it usually means you're taking out the tonsils and the adenoids, or one or the other, or both. Tonsils you're removing, adenoids, because they're a pad, you're technically shaving them away. And that's often your treatment for sleep apnea, or sleep disordered breathing in pediatrics. Very seldom, actually, I've never seen, and I don't even think it's possible, for certain ages to have devices in their mouth, meaning any type of mechanical equipment, such as a CPAP, to help them. But with a pediatric patient is, hopefully, or most likely, they're cured following surgery. When it comes to adults, ironically, and I just went through this with my husband, I had said my husband definitely has blockage in his nares, and I said, okay, well, I think he has sleep apnea, is the treatment to address his nares. And the ENT told me, no, they don't do that in adults, which was mind-boggling to me, because if it's obstructed, and he has sleep apnea, is a CPAP going to even make a difference or be as effective as it could be if he was able to breathe optimally? That I would think so. So there are other options, though, and was my very long point to get here, is that there are other options for to address sleep disordered breathing in the adult population. Again, this is not in lieu of a CPAP. Before you would try it, we would want to obviously speak with you. You'd have to take the questionnaire, because we want to make sure that you're choosing it for the right reason. And one of the things is myofunctional therapy is being recommended, and has been for a while, but it's like picking up momentum now, especially with those dentists that are heavy into the sleep medicine. They are working hand in hand with a myofunctional therapist to help develop the strength in the oral cavity, and it's particularly in the back of the oral cavity, working to support tongue positioning, space in the mouth, assessing and supporting the lip closure and breathing through your nose. And you could do all of those things with something called myofunctional therapy. And it can be a speech pathologist, it can be a dental hygienist. Just if there's more going on than sleep, or if there's any speech or swallowing issues, then you would have to see a speech pathologist. But if it's just working through some of the sleep disordered breathing, and that's your only concern, then you can definitely see a dental hygienist who specializes in myofunctional therapy. Or you can see, like I said, a speech pathologist who specializes in myofunctional therapy. But one of the things that, as a myofunctional therapist, one of the things that I always found challenging is whatever we work on in session, how am I going to guarantee that they're doing it accurately when they're practicing at home? And what can I do to, obviously, everything we learn is on a conscious level and a subconscious level. Is there a way to make that transition? So, is there a way to go from that, and I don't have to rely just on the patient or their family for feedback? That I can make sure that anytime they do it correctly, every time they do an exercise, it's being done correctly. And so that's how the device that we just patented, or I just patented, called the Spot Pal, came to be. And the Spot Pal's goal is to keep your tongue, to give the tongue a place to sit, so that you're able to maximize the movement of your tongue, making contact with the hard palate. And again, the sooner and younger that they're utilizing this device, the less likely or the less intensity of ortho they may need in the future. So if your child has a high and narrow palate, most of the time, that's secondary to a tongue thrust. Your tongue is swallowing the wrong way, and it is a compensatory strategy. It's pushing up against your hard palate, and your hard palate is malleable. So, and the tongue is as strong as your heart. So that malleable bone, when when that tongue or that strong muscle like the heart pushes against that malleable bone, it makes your palate high and narrow. And the top of your mouth is the bottom of your nose. So the sooner we can have our patients in a Spot Pal, the sooner we can teach them how their tongue should be, what their tongue should be doing. But beyond even teaching them, if they don't have access to a myofunctional therapist who's working with Spot Pal, then you would use the Spot Pal with some preliminary tongue training exercises to support your child or the patient with teaching them where their tongue needs to go, but using the Spot Pal to do it. And the Spot Pal is really showing the tongue where it needs to sit, so that it can expand the palate the way it needs to. There's less of a chance of palate expansion, or less of the palate expansion has to be less intensive because of a Spot Pal. Same thing with orthodonture. Hopefully we could get the tongue off the teeth, and the teeth don't move as much as they would have without a Spot Pal. So we're expediting the course of treatment, but not only that, maximizing their long-term retention, which I would tell you how many patients I see that will say my teeth moved after my braces. Even when I wear my retainer, if I don't wear it for 2 days and I put it back in, my teeth hurt because they're moving that quickly. And that's from the tongue. So if we can get in the mouth quick enough with a Spot Pal, and if we're lucky enough to do it in conjunction with therapy, we're going to proactively support their long-term dental plan or dental path that they're going on. But we're also going to maximize how much space they have in their airway, in their nose, and in the back of the throat. And the Spot Pal allows for the tongue to sit where it needs to, which again is opening up and maximizing the airway space. And that is resulting in less sleep disordered breathing. So what we've seen and what's been reported back to us is that the patients are snoring not at all, if not significantly less. They are less restless. The patients are reporting that they feel more rested when they wake up in the morning, more attentive. They also find that from training their tongue to sit where it needs to while they're asleep, even once they take the appliance out and they don't wear it for a few weeks or a few days for whatever reason, their tongue is still where it should be. And then if they start to see that they're or being reported that they're snoring again or what have you, then they put their appliance back in, and they leave it in until the symptoms have lessened or resolved. And if they want, they can take it out again. So there's definitely guidelines, but we're definitely seeing improvements. And again, this is not in lieu of a CPAP. And I would highly recommend making sure that you have been evaluated. But if you think that it would be helpful, and it's not a detriment, you don't have something that requires more intensive intervention than this, then I would definitely try it. We're getting a lot of responses from wives, a lot of feedback. I can tell you, as a wife of a husband that's wearing it, it's been amazing. So if you want more information about sleep disorders and myofunctional therapy, or SpotPal, you can reach us on our website, which is lispeech.com, or go to spotpal.com and take the questionnaire. See if you are a candidate for SpotPal. It does work on many other areas as well, but if you're having issues with sleep disordered breathing, feel free to try it.
I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.